Hello everyone, welcome back to the Pharmacology Masterclass series by Dentospedia, one of the trusted platform for dental board examination preparation. So the topic for today is bone modifying drugs. It is also one of the most important topic in pharmacology because we have to deal with the most common bones in our head and neck regions, that is maxilla and mandible. So we need to have an understanding what drugs have effects in the bone. Let's start. Angiogenic agents are widely used to manage the conditions like osteoporosis, metastatic bone diseases, Paget disease, and multiple myeloma. So basically, these are some of the bone pathology you will be learning in detail in oral pathology. So these bone pathology having will have to treat by the bone modified drugs like bisphosphonate, denosumab, and anti-resorptive. What do you mean by anti-resorptive? It will inhibit the osteoclast, that is the resorption of the bone will also be inhibited. So you must be knowing there is osteoclast for resorption of the bone, osteoblast for formation of the bone. So anti-resorptive will inhibit the osteoclast. And anti-angiogenic agents, that will have decreasing the blood supply of the bone also. So it will have also delayed healing because of there is decrease in blood supply. So this is one of the side effects that it can have delayed healing. While effective in preventing bone loss and skeletal complication, they are also associated with the impaired bone healing, most notable medication-related osteonecrosis of the jaw. Because of this activity of this drug, it can lead to osteonecrosis of the jaw. Osteo means bone, necrosis means dead, that the bone of the jaw will be basically dead. So this is one of the cause, one of the biggest side effects of bone modified drugs. Now, for dental professionals, understanding this medication very much important for treatment planning, especially extraction, implant, surgery, because we basically work on the jaw only, that is mandible and maxilla. So it is very much important for us. Preventing BRONJ, that is important. Recognizing healing delays and communicating with the physician regarding the medication holiday. What is a holiday? That is stopping medication for some time, for the time being that we are doing our dental treatment. This chapter breaks down the pharmacology, clinical implication, and safe dental protocol related to these drugs. Now, the first is the bisphonate mechanism, types, and indication. Now, what are the bisphonate? Bisphonate are the anti-resorptive agents that bind strongly to the hydroxyapatite in the bone, inhibit the osteoclast-mediated bone resorption. So it will inhibit the osteoclast and it binds strongly to the hydroxyapatite in the bone. So you must be knowing that bone is having increased calcium hydroxyapatite. So it will go and bind to that only. That is a bisphonate. That's why it is having the increased half-life because it strongly bind to the bone. Mechanism of action important. You need to remember the name. Inhibit the farnesyl pyrophosphate synthesis in the melavinate pathway. Result in the osteoclast apoptosis and reducing bone turnover. Now this is just an diagram. Bisphonate, that is an anti-resorptive agent, binds to the hydroxyapatite in the bone. Mechanism, inhibit the farnesyl pyrophosphate in the melavinate pipeline. You can see this is a drug. It is binding to the hydroxyapatite, that is reducing the bone turnover by result in the osteoclast apoptosis. Okay, so this is just an diagrammatic representation so that you can remember in a better way. Now types important. So what do you give orally? That is alendronate, risedronate, abidronate. Potency is very moderate and it is commonly used for osteoporosis. Now IV you can give for zoledronate, that is a Zometa, that is a brand name, and pamidronate, that is having the high potency and commonly used for cancer metastasis, hypercalcemia, that is increase in calcium. Zonedronate is 100 to 1000 times more potent than the oral bisphonates. So the other bone active drugs that you should know. First is the rankle inhibitor. Okay. So rankle, these are some of the receptors you will be learning in the remodeling pathway of the bone. Here you just remember the rankle inhibitor. Example is the Denosumab. That is this is a brand name, that is a Prolia, Zigeva. And what is the mechanism? This is important to remember. Monoclonal antibody that blocks the rankle, thereby decreasing the osteoclast formation. Used for osteoporosis and bone metastasis. Now, anti-angiogenic, that is the bevacizumab and the sunitinib that inhibit the blood vessel formation. It is used for cancer therapy. Now, SERMs. What do you mean by SERMs? SERMs is the selective estrogen receptor mediator. Okay. So here, why estrogen? Estrogen is also one of the hormone that helps in bone strength. Okay, so it will in the act as a estrogen, because sometimes there is deficiency of the estrogen, especially in women, that can lead to osteoporosis. So here we are artificially giving estrogen mimic drugs, so like the raloxifene, that is very most commonly used for women after certain age, because after certain age the bone strength of the woman decreases. So estrogen receptor modulator, it is basically used for postmenopausal osteoporosis. As I told you, in women, it is basically used. Now, anabolics like teriparatide or abaloparatide that stimulate the osteoblast, that is the PTH analogs. This is also one way to decrease absorption by increasing the formation. So you can stimulate the osteoblast. Now, severe osteoporosis you can do, and you can use in that. And calcitonin is the example is the salmon calcitonin. It inhibits the osteoclast. Osteoporosis, less use. Okay. So what is the role of calcitonin, parathyroid hormone? This you will be learning in physiology. Here just remember the drug classes. Okay, this is also important. So thank you so much for watching. I hope you liked the video, and please download our app Dentospedia for more structured and curated module for pharmacology. Not only pharmacology, every subject you will be getting here in a very structured format, from video lectures to quizzes to mock tests to everything that you need for your examination that will ace your preparation. So thank you so much and happy learning.